Hi, this is Winston Louis from Microtia MD. In Microtia, hearing is a key concern for many families. Sound is transmitted to the auditory system via two primary pathways: air conduction and bone conduction. Let's first discuss air conduction. Sound waves are collected by the auricle, the external ear, and travel through the external auditory canal, causing the tympanic membrane, also known as the eardrum, to vibrate. This vibration are then transmitted via the ossicles, which includes the malleus, incus, and the stapes, in the middle ear, which amplifies the sound and travel to the cochlea in the inner ear. Within the cochlea, the movement of the hair cells transform these mechanical vibration into electrical signals. These signals are then conveyed through the auditory nerve to the auditory cortex in the brain, where they interpret as sounds. This is the typical mechanism of air conduction. In cases of microtia, where the external ear is absent or malformed, the external auditory canal is atresia, meaning it's closed off. The air conduction pathway is disrupted. However, sound can still reach the inner ear through bone conduction by transmitting vibration directly through the skull bone to the cochlea. In most children with microtia, inner ear structure are normal. This explains why even in unilateral microtia and aurea atresia, the child may still be able to perceive sound via bone conduction. This can be demonstrated on imaging studies such as CT scans. For instance, in some cases, one side shows a patent external auditory canal, while the other side is atretic. This allows for air conduction on the normal side. In other cases where bilateral aurea atresia is present, although air conduction is not possible, the child can still hear through bone conduction if the cochlear structure are intact. In summary, whether through air or bone conduction, sound can ultimately be transmitted to the inner ear and processed by the brain. Having a normal developed cochlea is the key clinical consideration when evaluating auditory function and planning appropriate management strategies. If this video interests you and you want to know more information or you have any question about microtia, feel free to leave us a comment or contact us at Microtia MD. Thanks for watching and we'll see you next time.